Hi, my name is Helen Chu. I'm the Fellowship Program Director here at the UC Davis Comprehensive Cancer Center in Hematology and Oncology. I want to thank you for your interest in our program, and I hope that you get to know a little bit more about our program through the video. Before we start the video, I'd like to tell you just a few things about our program which I think should stand out. The first is that you will have an excellent clinical training opportunity here if you come to UC Davis. Our first-year fellows rotate through subspecialty clinics with experts in their field, followed by second and third year of having a true continuity clinic where they see and manage their own patients. Throughout all 3 years, they also have a continuity clinic at the VA. This really gives you great ownership of the patients, and I think you'll find that you will see a variety of exciting diagnoses and meet patients from across this great region. Secondly, you will have research opportunities throughout the UC Davis Comprehensive Cancer Center. This includes clinical trials opportunities. This includes participation in our mentored clinical research training program, or MCRTP, and starting in 2021, an opportunity to work with other basic scientists in a T32 training program. Our fellows rotate through both UC Davis Medical Center and the VA Medical Center in Sacramento. During the first year of fellowship, fellows will rotate through subspecialty clinics based at UC Davis Comprehensive Cancer Center with experts in their field, and will also have a weekly continuity clinic at the VA. During second and third year of fellowship, fellows have their own panel of patients in their continuity clinic at UC Davis Comprehensive Cancer Center, allowing for a unique training experience that separates our program from many others. Patient panels are filled with diverse patients who are independently managed by the fellow in a supervised setting. We have made a variety of changes during the past 2 years to our fellowship program based on feedback from our fellows, as seen here. These changes have allowed our fellows to participate in more research in a variety of ways. Over the years, we have had increasing participation in the mentored clinical research training program, also known as the MCRTP. This is a 2-year program where fellows complete a Master's of Advanced Study in Clinical Research. This program allows those fellows with a research interest to focus on a particular field of study in a structured environment. Starting in 2021, fellows also will have the option to engage in lab-based research with the opportunities to participate in the T32 training program in oncogenic signals and chromosome biology. Many of our fellows pursue outcomes-based research with our renowned faculty using the wealth of data available from the California Cancer Registry. Finally, I think if you choose to come here to do your training, you will find UC Davis to be an extremely collegial place, from faculty to your fellows and co-house staff. I know that this is an unusual year and it will be hard for you to maybe get that feeling, but I hope that by interviewing with us and enjoying the video, you'll get a little taste of what it's like at UC Davis. Again, thank you very much for your interest in our program, and we look forward to meeting you virtually.
The UC Davis Comprehensive Cancer Center is one of 71 cancer centers designated by the National Cancer Institute. It's more than just a good housekeeping stamp of approval to be a designated cancer center. What it means is that we are recognized for the depth and breadth of cancer research, clinical care, education training, and community outreach throughout the spectrum of cancer. We are considered a world-class cancer center. We have world-class researchers and clinicians with a singular mission, and that's trying to reduce the burden of cancer in our neck of the woods. We call it our catchment area, but we intend to spread that across the state, across the nation, and across the globe. We do that by leveraging the unique strengths of UC Davis, and then using those strengths to solve the cancer problem. When you go over our website and through our written materials, you'll realize that UC Davis has a lot to offer. It has a unique environment that is positioned to solve cancer problems. We have the world's #1 ag school, the world's #1 vet school, which allows us access to companion animals with cancer, who live with us, who have the same cancer problems as we do as humans, and we're able to learn from each other. We have one of the world's leading engineering schools, which has resulted in the development of world-class imaging devices, such as the PET Explorer, which is the world's most powerful PET scan. It's the most accurate and most advanced PET scanner, delivering high-resolution scans with less radiation, for example. We have a well-developed and mature clinical trials program, offering over 200 active clinical trials at any one time. And we accrue over 300 patients to those trials each year, and growing. Many of those trials are investigator-initiated trials. What that means is that we do clinical trials developed and conducted by our faculty. So these are clinical trials that use UC Davis science, advance them through the lab, and translate them into the clinic. So thank you so much for visiting us today. I think that you will find your visit here very productive, and would be happy to answer any questions you have during your stay. So have a great time with us, and hopefully you choose UC Davis. I think this is one of the world's greatest institutions and a great training ground for future oncologists.
Hi, my name is Ted One. I'm the division chief here at the University of California at Davis, and I'm here to give you a virtual hello and thank you for considering our division for the next step in your training. If you're the typical age of one seeking a hematology oncology fellowship, I've been here longer than you've been alive. And during that time, I've seen it grow from sort of a mom and pop operation with just 6 faculty in hematology oncology to one with now over 40 faculty with 30 clinicians. At the same time, our campus has grown from really what was just a hospital to a true medical center. We've gone from just a few tens of millions of dollars in extramural funding to over 300 million. And for you, that is important because now we offer the breadth and depth of hematology oncology, as well as a vibrant clinical and clinical research environment to build the next part of your career. Although we're quite proud of the fact that we have a reputation of creating and nurturing great clinicians who have gone out to practice, in the more recent years, we've developed also clinical investigators who have enrolled in our clinical investigator tracks, as well as been funded on our Oncology K Award. So take a virtual look around, ask questions during your interview, and again, thank you for considering UC Davis for the next step in your training.
Hi, I'm Fred Myers. I'm one of the professors in the Division of Hematology Oncology, and I'm also the director of the Center for Precision Medicine. But most importantly, I direct several of the research training grants in the Clinical Translational Science Center, and I direct career development for our cancer center. I hope you've thought about your career development, and particularly how research might play a role in your career satisfaction. These days, research is not just molecular biology and laboratory sciences, although it does play an important part in oncology. It's clinical translational research, including clinical trials. But it's also dissemination and implementation science, where we really look at, if you will, how we're delivering care, what the systems of care are, and what quality is. And for many of us, it also extends to policy and advocacy and engaging our community. That's the spectrum of modern cancer research, and you can be a part of that. We've had a lot of fellows in the last few years participate in our training programs, and they've done extraordinarily well. They've gone from the Mentored Clinical Research Training Program, which is our 2-year master's degree program, to either a K award in the CTSC or in the Cancer Center, and many then on to NIH K funding. So we have a proven pathway. We have a lot of faculty at UC Davis who have gone through this. They've ended up being the next generation of leaders. that can be you. We have the mentors and the willingness and the support to help you have a very satisfying career in clinical research.
Hi everyone, my name is Roya Sheridan. I am one of the medical oncologists here at our Sacramento VA. Some of the things I've loved about working here the past couple of years, our staff is incredibly close-knit and supportive. I love that we can get really any FDA-approved medication or even non-FDA-approved medications for our patients fairly easily, which is quite a blessing in the world of oncology. Our patients are incredibly resilient, incredibly graceful. They have lots of great stories and they're just wonderful to work with overall. We love having our fellows here. The fellows are really integral to our clinic functioning as a whole, and I very much hope to see you guys here next fall.
Northern California, and specifically Sacramento, is an exciting place to live. Being the capital of California, we are fortunate to be in close proximity to many different resources, from gorgeous scenery and hiking in Lake Tahoe, to hiking and biking in the wine country of Napa, Sonoma, to amazing day trips across the broader San Francisco Bay Area. The vast diversity of these options makes Sacramento an enviable location to spend your training years. Thank you for your interest in our Hematology Oncology Fellowship Program at UC Davis. Our unique program sets us apart from many others. We wish you the best of luck in your search and look forward to meeting you soon.